Assalamualaikum and greetings to all. My name is Muhammad Aznuddin Abdul Razak from Family Health Research Center, Institute for Public Health. Today, I will present a findings from an article entitled Self-Reported Modifiable Risk Factors of Cardiovascular Disease Among Older Adults in Malaysia, a cross-sectional study of prevalence and clustering. This paper has been published this year in International Journal of Environmental Research and Public Health. Okay, in the introduction section, this paper described the burden of cardiovascular disease or CVD as a leading cause of death in 2019. CVD was expected to increase with the growth of aging population. This is due to increasing unhealthy lifestyle, rapid industrialization and urbanization even in low-middle income countries. As we expected, Malaysia will become aging nation with 14% older adults aged 60 years and above in 2030 and up to 24% in 2050. Previous data, Malaysia reported CVD's mortality was ranked first in 2019. There are 5 major CVD risk factors including diabetes, hypertension, hypercholesterolemia, obesity, and smoking. With the combination of these risk factors create a cluster that increase the prevalence of CVD. Here is why knowledge and information on the burden of clustering CVD risk factors are crucial today. Therefore, this paper aims to determine the prevalence and clustering of self-reported modifiable CVD risk factors among older adults in Malaysia. The data was obtained from National Health and Morbidity Survey 2018, a cross-sectional study with two-stage cluster sampling design by using enumeration block as primary sampling unit and living quarters with older adults aged 50 years and above as the secondary sampling unit. We were conducting face-to-face interview using mobile device to obtain socio-demographic profile and measure self-reported medical status such as diabetes, hypertension, hypercholesterolemia, smoking, physical activity, fruit and vegetable consumption. We also took anthropometric measurement using weighing scale and stadiometer. We used chi-square test and multiple logistic regression in our data analysis. Okay, the results show the highest prevalence of CVD risk factor among older adults was obesity with 58.4%, followed by hypertension 42.2%, hypercholesterolemia 35.6%, diabetes 23.3%, and current smoking 17.5%. When clustering these risk factors into at least one, more than one, and more than two risks, the result reported 83.2% older adults had at least one risk factor, while 75.4% and 62.6% for more than one risk factor and more than two risk factors respectively. Okay, multiple logistic regression was performed to determine the associated factors of clustering CVD risk factors. From the result, we found that increasing of age, ethnicity, unemployment had significant association for all three groups of clustering. Being male and those who reside in urban locality show significant association with at least one risk factor and cluster 2 and more. Those who are not physically active was associated with 2 and more risk factors and 3 and more risk factors. Only cluster 3 and more risk factors had significant association with marital status. Okay, from the above result, we can conclude that the prevalence of clustering more than one CVD risk factors indicate an increased risk for CVD morbidity and mortality among the older population. Our findings show the number was worse than study in China. However, this could be explained due to difference in study population, age range, definition, and diagnostic criteria has been used. Inclusion of smoking as one of CVD risk factors may be somehow increase the tendency of risk factor clustering in men. As we know, previous study found smoking is more prevalent among men than women. Clustering of risk factors increased by increasing of age. One of the possible reasons for this observation is that competing risks for non-CVD morbidities such as chronic lung disease and cancer occurs after 70 years old. Rapid urbanization, lifestyle, and difference in culture and socio-economic circumstance could be the reason for clustering risk factors was significantly associated with urban population and different among ethnicity. Physical inactivity also reported had significant association with the clustering CVD risk factors. Older adults who often have multiple health conditions are encouraged to be as physically active as possible to gain more health benefits from the activity. From the findings, we suggest to support the clinical importance of assessing multiple risk factors rather than traditional approach that target a single risk factors for CVD prevention and management. With that, I end my presentation with a thank you.